Afternoon. Hello. All right, we're gonna get started. I just want to say welcome back. I hope everyone had a really good lunch and had the opportunity to connect and network with your colleagues from across the country. For those of you who've been in previous sessions for what we refer to as our federal session, I think you'll notice that today it's unusually long. It's about 3 hours, but we will have a lot to accomplish today, and it's actually going to be in two phases. So the first phase is we're going to have some information on the runaway and homeless youth management information system merging with the HUD's HMIS system. Then we're going to have some time for questions and answers after that. We're going to take a short break from 3:15 to 3:30, then we'll come back, and then we're going to share with you some of the initiatives that's been taking place at FISB. So we'll have some updates for you in terms of the work that we've been doing at the Family and Youth Services Bureau. So now, turning back to our first agenda item, I know that we refer to it as a RHYMIS HMIS integration. And I know it's a long time coming. I think when I first came to FISB, they told me it had been about 3 years that we've heard your voices in terms of the data collection burden, if you have both a FISB grant and a HUD grant, and the data collection burden was enormous on you in terms of entering into two systems. And so with that, we heard your voices and we began to have discussions with HUD on what a streamlined system would look like. And so with that, we also worked with our partners, not just HUD, but it's a federal initiative. So we're working with the Veterans Administration as well as the Substance Abuse and Mental Health Services Administration, or SAMHSA. And so we looked at all of the data collection points, and we had to make some concessions. We worked really hard to see what would a streamlined data system look like, so we have one data repository for homeless data. And I know that the work that we've done with the U.S. Interagency Council on Homelessness has been a catalyst in terms of the work we're doing to end youth homelessness by 2020. And so with that being said, we looked at to get better data, what would it take to have a bigger picture in terms of having homeless data in one data repository, and how do we wrap our arms around that? And so I think the panel members here we have today have been at the table doing that consistently. And so I know we have a lot to cover today, so I want to go ahead and turn it over to the panel members. We have here on my right, Dr. Brett Brown, who is with ACF's, the Office of Data Analysis, Research, and Evaluation. And then we also have Talisa Bird, who is a social science analyst within the Office of Data Analysis, Research, and Evaluation. And then on my left, we have Sarah Hunter, who was formerly an ACF employee, but is now with HUD. And then on the phone, we have Karen de Blasio with HUD, who unfortunately couldn't be here, but it just shows the commitment that HUD has to this effort as well. And then we also have Darlene Newsom, who will be joining us in about 15 minutes or so. She's the local continuum of care for Phoenix, Arizona. So without further ado, I'm going to turn it over to Dr. Brett Brown.
Thank you. Thank you. Great. Can everybody hear me okay? All right. Good. Well, I'm going to start by giving you a quick overview of how it is we split up the presentation so you'll get a sense for what's coming. And then we'll proceed to the presentations. We're going to start, I'm going to give you sort of the broader context of federal efforts to end homelessness in the U.S. and how this migration over to the HMIS system fits within that larger picture. Also going to talk a little bit about the rationale of why, what motivated us to require this, and also talk a little about the anticipated advantages, both for you and for at the federal level once this is complete and we start having more complete and integrated data on youth homelessness. Next will be my colleague Sarah Hunter from HUD. She will be giving you an overview of the continuum of care. I know many of you are already members, but many are not, and I think knowing a little bit more about the background and history of COCs and how they function will be useful for everyone. And we will also be discussing the Homeless Management Information Systems, or HMIS. Darlene Newsom, when she gets here, she's fighting her way from the middle of downtown right now, I think. Will give us more personal testimony on how the local continuum of care here works. She also has a long history of involvement with youth services, so is able to see COCs from that perspective, and I think that will be also helpful. And finally, to Lisa Burt, we'll talk more about the concrete steps, the nuts and bolts about making this transition training, data migration, and so forth. Okay. Excellent. All right, so this story begins, of course, with a commitment on the part of the Obama administration to end homelessness in the U.S., including chronic and veterans homelessness by 2015, family and youth homelessness by 2020. Those are aspirational goals, but if you look at some of the most recent report from Usage, you see that actually a very significant amount of progress has made in both reducing chronic and veterans homelessness. So it is possible through these sorts of efforts to move the needle on that. They began federal work by establishing the U.S. Interagency Council on Homelessness. Most of you are familiar with that. So although for those of you who are newer, and there were quite a few new who stood up, there is a plan a larger plan that they produced, and also a youth-specific plan, framework to end youth homelessness, which is on the Usage website. And I strongly recommend that, especially for the newbies in the audience. This Usage consisted of federation of 19 federal agencies, plus national, state, and local organizations, all dedicated to ending homelessness. Major challenges that they identified, and this is not exhaustive, but these are the ones that are the most relevant for today's conversation, include developing better data on homeless populations. When they started, and in fact very much to this day, we still don't really have any idea how many homeless there are in the country, how many youth homeless there are in the country. The data that we do have, much of it administrative data, is balkanized and across many different administrative data systems and in forms that are not strictly compatible, so you can't easily combine them to get a complete picture. And that was the place where they started finding ways to change that. Second, there was clearly a need for better coordination among programs, both at the national and local levels, and Usage is intended to provide that coordination at the national level. Continuums of care, I think, are a good, strong example of efforts to coordinate those efforts at the local level. So, let me go ahead. All right. So, what has Usage done to end homelessness? There are several efforts. There is that we should know about. Something called the Youth Intervention Model was developed. And this is a model that really is kind of a virtuous, that describes a virtuous cycle of service implementation, evaluation, redesign, going into the next cycle. It worked to identify existing evidence-based practices as a starting point. Also emphasized the need for good screening, use of evidence-based practices, appropriate evaluation, good data collection, then sort of step back and reflection on what we could do better and what is the meaning of the new information and the new knowledge that's been generated, and then a new cycle begins. There's also an effort now to try to bring that, what is now a fairly, a 10,000-foot view of how these things ought to go down to more concrete and practical terms, so that program providers can use it as a practical tool for guiding their work in improving the kind of services that they're able to deliver. Second was the youth count study, and this was a study that was done a little over a year ago. Some of the folks in the room participated in that study. There were 9 sites altogether, and that was an kind of an attempt to improve the, to explore some alternatives for the methodologies for being able to count youth more completely on these one-night counts. There was a report that was put out by the Urban Institute, who oversaw the study, and also for those of you who are participating in the next year's PIT count, that's not a bad place to start for looking for ideas on how to improve your enumeration for those. Okay, and third and finally is the RHYMIS HMIS immigration, and that's our main focus for today. And this is part of a larger multi-agency effort to align and integrate administrative data on homeless, and you'll hear more details about that in a bit. Okay. So why are we so interested in improving our quality of our data? And I just wanted to go back, it's something that people know, but it bears reviewing. Data is a powerful tool. It tells you how many people are in need. It tells you who are in need, so it gives you different subgroups that have distinct needs, and so you can tailor your services. We need to know, are they being served appropriately and adequately? At a more prosaic or mundane level, actually, we use data and we use the RHYMIS system to look at program goals and how well people are going at meeting program goals, and as well as the program requirements. And finally, we need to have better data to know whether or not we're being successful in ending youth homelessness. Right now, not really able to do that very well. It's important at the grantee level. It's important to have this kind of rich data systems at the community level for joint planning, and it's important to have this at the national level, both for planning purposes and for funding purposes. All right. So why the move to HMIS? What is the rationale for that? As I say, this is a part of a larger multi-agency effort that includes the Veterans Administration, SAMHSA, FISB, and HUD, both adult and youth homeless data. The goals for that effort include producing better data by aligning the measures. So in fact, something that's already been accomplished is those agencies have all gotten together and identified a single data standard that includes both measures that are just particular to individual programs, but also we have quite a list of universal measures that are the same across all programs, or sometimes they're the same across multiple programs, but not all programs. By making sure that we're asking questions the same way, it's easier to take the data that are being generated from all these different programs and combine them in ways to get a complete and more accurate picture of the size of the homeless population. We can get more complete counts, more useful measures. We have, this time around, the main goal for this migration really was just to get the RHYMIS data over into HMIS systems. So there was not a lot of effort, nor was there a lot of time to add new questions. Nevertheless, there was a few questions that were already in HMIS that you'll see more in a moment that we thought would be extremely useful for you. So we added those to the list. Talisa will list those in a moment. And at least one new set of measures around human trafficking, which we can talk some today. I really would like to dig into that a little more in depth tomorrow at 9 o'clock to get some feelings on what those measures mean, how those data can be collected effectively, and what are some of the barriers to collecting those sorts of data. Another goal for this move to HMIS was really just improved visibility for RHY programs and the data. Are all of you familiar with HUD's annual homeless assessment report to Congress, the AHAR? I believe it just came out, didn't it? Just the new version just came out. It's really, from a lot of people, including Congress, is the go-to publication for data on homelessness in the United States. If you want to know numbers, that's where you go. We're not in there right now. And it's very important, and we felt to be very important, that we do get the runaway and homeless youth data into that report, and that required that we get the data into the HMIS system, because that's how those data are gathered. They go from the HMIS systems up through the continuums of care, and from there they bubble up to HUD and they end up in the report. And so if we want our youth and our work to be fully noticed, that's where we need to be. So very simply, and I believe Mark Greenberg was saying this morning, better data can lead to at least better arguments for more funding. So this is all pretty straightforward about why this is important to do. All right. We're also looking to improve coordination with other local service providers through better data for planning at the community level. So if you joining and continue to carry your HMIS data, will get integrated in with other providers' data, and a lot of COCs use that as a community level planning tool, so they can help coordinate their work together and get a fuller picture. And another reason we're very hopeful about people, what's going to happen when people, more organizations join the continuums of care, is that it's important to have RHY voices and goals woven into the continuum of care planning. And I know that the experience there has been mixed. There have been some very good experiences, and I think you'll hear, you will definitely, if you come to the 9 o'clock session tomorrow, you will hear about some more positive experiences. We have Ken McKinley from Tumbleweeds and John Kufer from Lighthouse will both be speaking tomorrow, and they'll be talking about their experience with HMIS and the continuum of care in a COC that is quite welcoming of RHY programs. All right, let's see, one more. All right, one of the benefits for the expected benefits for the RHY grantees. Well, first and foremost, I think, the hope for reduced data entry burden for many of you who are already using HMIS software for at least some of their grants. I just want to see, can we get a show of hands? How many people are a member of their continuum of care? That's over half. That's good. Most of you are using HMIS for some reporting purposes already. Yes, no? Yes. More yeses than nos, but a lot of you. Okay. The point being that that for everyone who's already using that, rather than having to enter HMIS data for some reporting and RHYMIS and use the RHYMIS software for our reporting, you'll now be able to use a single system which has, a single interface and a single design and a single set of technical assistance, and it should just go more smoothly once the transition is complete. All right. And we also expect that as I say, you will benefit directly from more useful information you'll be able to get, and having access to the COC data, and also improve coordination with local providers. Again, I know that good coordination, good relationships don't just happen. They have to be fought for sometimes. So I know this is going to be a chore, but hopefully one that will pay off in big ways for your programs and for runaway and homeless youth. All right, so I think next I'll have Sarah Hunter, who works in Housing and Urban Development, and she'll talk about continuums of care and the HMIS data systems.
So who chose this podium? I actually like it because you can see my head over it. There are many that I actually can't be seen over. And I can't see the screen, so I'll just make do. So good afternoon. Thanks, Brett, Talisa, Risa, and thanks to all of you for having me. And thanks to ACYF and FISB for keeping the work of ending youth homelessness at the top of the agenda. Thanks to all of you that are here with us today, who day in and day out are working tirelessly to help make a difference for the young people in your communities. You truly do inspire me, and I thank you for your work. I bring you greetings. I bring you greetings from the folks at HUD who are working to keep raising the profile of youth homelessness too. Some of you know Matt Aronson and Norm Suchar, and then Karen de Blasio, my colleague who's on the phone with us today. Karen has been key on our HUD side to keeping us moving along with our data alignment and integration. So Karen, let me give you a big public thanks. So Brett did a little bit of this, but I want to get a little more robust sense of who's in the room. So how many of you regularly do data entry or fill out intake or exit forms for your organization? Nearly the whole room. Okay. I'm saying that for Karen. Karen's benefit. Okay. So how many of you currently have a relationship with your continuum of care? A good number, maybe half. And if you don't have a good idea of who your continuum of care is yet, don't fret, because we'll get to that in a bit. So how many of you have used HMIS before or know that your organization uses HMIS? Yep, roughly half of the room. And just to get the other half, let me just see this. How many have never used HMIS before or not sure if your organization uses it?
So everyone's going to be at the session tomorrow, right?
Brett says that's everyone who's going to be at the session tomorrow, right? All right, so for those of you who have a relationship with your continuum of care and who are already using HMIS, don't completely check out on me. You might be able to use some of the supposed tos for COCs I'm about to tell you about when you go back home. For those of you who don't yet have those relationships, we're going to ask you to build them. And this is key. We're also asking the COCs to work on their relationships with you too. I think Debbie mentioned this earlier in the earlier session. A message to COCs is coming out very soon that will look a lot like the letter that you got from FISB. So I'm going to start by describing for you the continuum of care because it's essential to understanding HMIS, both the how it works and the why it works the way it does. So the continuum of care, or the COC, we'll use those words interchangeably, is a local coalition of organizations coming together to create a local system responsible for ending homelessness. It has a governing body with a lead agency who's responsible for keeping the trains running. HUD funds the COCs through an annual competition for new projects and for renewals, and the governing legislation is called HEARTH. All right, so in good COCs, homeless service providers are members who are largely responsible for decision making and collectively make decisions about funding in a way that represents the full need of homeless services in a community. And some of you in this room may scoff at me for that. It's not perfect in all places. Homeless service providers, including youth homeless service providers, can participate in any or all of the working groups. And these working groups range from funding to population-specific improvement and inclusion. I've seen many COCs with youth homeless providers with seats at every table, and I've seen some COCs where youth providers have a hard time doing more than getting in the door, if they get in the door at all. So we do have work to do. I'll get more on that. Thanks for moving the TV. I can see it now. So COCs define their own jurisdictions, and in most states, these align with city or county boundaries. And the rest of the state is usually combined to form a balance of state continuum. You can see here the example of Texas. There are 11 different COCs in Texas, one that covers the balance of the state with nearly 100 counties, and one that covers around 16 counties. You can see that's kind of the second biggest one. And then there are some that are a single city and its surrounding county, like the San Antonio Bexar County and Houston Harris County. Cheers to the Texas folks in the room. Where are you at? All right. So this means that I can't tell you where your COC is, who your COC is, unless I know where your organization is. That's in part why you received those letters from FISB, trying to help connect you with the folks in your local jurisdiction. And your letter would have looked different from somebody else across the country, because the COC that you're related to, obviously, is local. So these are HUD's stated goals for the COCs. The top level goal for COCs is to create a system across all populations for not only addressing but ending homelessness. I should note, this is not the norm, but some COCs out there still think they only have to care about one subpopulation at a time, and only have to care about those providers in a community who are getting money from HUD to end chronic or veteran homelessness. And to be frank, some COCs and some HUD staff still think it's not okay to care about youth homelessness, at least not yet, and that's not okay. We're not where we want to be yet, but we're working on it. Still, it's clear that all of these goals can apply for young people facing homelessness. So again, a system of providers working together to end homelessness for everyone. That's the idea. That's the idea behind the Hearth Act. That's the idea behind the continuums. Coordinating to get homeless individuals and families to the set of resources, both the targeted homeless resources and the mainstream resources, like healthcare coverage, TANF, job training, et cetera, that they need. You'll see HUD begin to line up behind these goals for young people behind the outcomes outlined in the USICH Youth Framework that Mark talked about a bit earlier today. So education and employment, well-being, permanent connections, and of course, housing that meets their needs. And an array of housing and services that take into account the specific developmental needs for youth. I work at HUD, and I just said that we're thinking about housing that takes into account the specific developmental needs for youth. I just want to be clear on that. So this is what we're kind of asking COCs to do. This is the planning cycle. We want them to use data to identify capacity. And I should say, this is the planning cycle that we're using in chronic veteran homelessness, that we're actually seeing make huge impacts in the number of people facing chronic homelessness that are still living on the streets, and the veterans in our country. I'll get to that a bit more in a second. But so we want to use data to identify capacity, to identify and prioritize gaps, to develop short and long-term strategies for each subpopulation of people facing homelessness, and then to implement those strategies. So you may be asking, why are you spending all this time explaining COCs to us? Brett said a little bit about this, but we thought you were going to talk about data. So here's why. So sorry, that offends Brett greatly. So here's why. Okay, the HMIS, the Homeless Management Information Systems, are local COC-based IT systems to collect data on homeless clients or service providers across the community. Each COC, each local system, is responsible for selecting and purchasing its own HMIS software system that complies with HUD, and now with our federal partners, because we're working together on these, complies with our standards. That includes privacy standards. I know that's a big issue for folks in the room. So you won't be responsible for going out and figuring out which HMIS to get. Don't worry about that. Your COC in your community has one already. The goal of using HMIS across service providers in a community is that data sharing can occur across service providers where appropriate, and where local communities can look at their data as a system and see collectively where agencies are meeting the needs of the community and where they're not. The system is also able to adapt to the multiple federal agencies' reporting needs. We really are working together on this. So local HMIS implementations are nearly always managed online. So you go to the COC's webpage, you click on the link to the secure system and log in. It can usually be accessed from any computer. Access to the system is managed by the COC lead and the HMIS system administrator at the COC. and you'll have to contact your COC lead and your HMIS system administrator. A few weeks ago, many of these data folks were in town in DC, and we told them you'd be coming to them. And they know you're coming also, because they also now have the data standards, and they've made their systems comply so that you can get your RHY-specific data that you need to input for your RHY-funded programs. So that was an example from Houston, I think, just their HMIS page. This is one just from Ohio's Balance of State. They look different. And I think, I'm going to look at Darlene, so I think this is actually the one here locally. So with that, because this is the one here locally, I'm actually going to transition to Darlene and ask her to talk a little bit about her experiences both with data and with youth providers. And then when Darlene's done, I'm going to come back and just have a few more words for you.
Thank you, Sarah. Again, I'm Darlene Newsom. I feel like I'm kind of back home because I was a runaway and homeless youth provider for 24 years. I've been in the field for 40, serving homelessness. I now live in Phoenix and I'm CEO of You Mom New Day Centers, which is a homeless shelter for families. We have 146 families that we care for on our campus. And we also have over 300 units of affordable housing, and about 25% of our population are under the age of 25. We have a full-service campus where we have not only shelter, but we also have extended shelter, which is what we used to be called our transitional shelter. And we have a medical clinic and barista training and food service training, child care center. In fact, we partner with Tumbleweed, the local youth shelter, that they can come and have some of their youth participate in our barista and food service training. And we also lease part of one of our buildings, so we have the first shelter for homeless youth between the ages of 18 and 25. So we're real excited about that partnership. But that partnership was part of the coordination that you've been hearing about today as part of your continuum of care. And I've got some random thoughts, so kind of just stick with me as far as the continuum of care and HMIS and data collection. And I have a couple questions to ask you. When you were asked if you had a relationship with your continuum of care board, how many of you actually receive funding from your continuum of care? Okay, well, a little bit less than a relationship. Because, you know, I get right down to the bare tactics of money. Because, you know, when you hear about, and I get a little bit frustrated, and that's why I've kind of been with the nonprofit world for most of my life, is because when I see 2020 up there as the year they're going to prioritize youth and families, it kind of makes me cringe. So it's even more important for you to be involved with your continuum of care board. I'm actually, we restructured our continuum of care this last year, and I'm on the board, and we have another provider that's on the board, and youth is part of my subpopulation, and youth is part of her subpopulation. So we have 13 seats. Of the 9 seats, 2 of them have subpopulations that they serve that we consider homeless youth. And that's important because my nickname is kind of like the broken record, because I don't give up, because in our continuum it's all about chronic homeless individuals, and not that that's not important, not that veterans are not important, but homeless youth and families are also important. And I think when you talk about, thank you, because I get real excited about that, because the next thing I'm going to talk to you about is the point in time survey. Is I hope at some point, since I have the podium, that we have a chance to look at that point in time, because that point in time is a disadvantage to youth and it's a disadvantage to families. And you know, in fact, our continuums only have to really do the point in time every other year. And in our continuum for several years, when we did the point in time, we would start publicizing the results, which resulted in really kind of negative against youth and families because it wasn't an accurate count. And, you know, so they count 10 homeless youth and they count it one less, and then they say that youth homelessness decreased by 10%. And I mean, that's frustrating. I don't mean to, but I think that if you're going to look at adding HMIS and make that a requirement of all of you, that you need to participate in your continuum of care boards and talk about the point in time and talk about the gathering of the information. Are there different strategies that can take place to count the number of homeless youth? When you get the information, is there another way that you can talk about the information publicly? Because I think that's real important as we move forward with some of these requirements, and we're requiring that braiding that everyone's talking about between HHS and HUD and the Department of Labor. I had the opportunity to attend a one-day workshop 2 weeks ago in Washington, D.C., where they brought members from HUD and the Department of Labor together to talk about how we can create more jobs and employment for homeless individuals, youth, and families, which I thought, isn't that great? I mean, when we talk about ending homelessness, no matter what population we're talking about, we need to be talking about housing and we need to be talking about employment. Now, our local continuum that we have here, we actually have 4 programs that are funded under the continuum of care. And we just did our rank and review, and we have 57 projects and $27 million here in Maricopa County, which is no small chunk of change. And of the 57 projects, the youth projects, the top rating was number 33, then it went 36, 42, and 47. 2 of the projects were housing projects, and 2 of the projects are still transitional projects. One of their projects, in fact, Tumbleweed, I don't think you mind me sharing this, had retooled one of their programs last year that was supportive services, because supportive services is being phased out. And so they retooled one of their programs, I think, to rapid rehousing and permanent supportive housing. Yeah. So I think that that's the other area I just want to touch upon, is that, you know, I'm kind of an old dog, but I can be taught new tricks. And, you know, it took a while to move me really towards the housing first movement. And I think in looking at your continuum of cares and looking at your transitional programs, they can be retooled. We retooled our transitional program. You can retool to rapid rehousing and other kind of housing interventions. 5 years ago, UMOM had 2 housing interventions. Now we have 9 different housing interventions. And there are best practices out there. The other area I want to touch upon is data collection. Now, the Hearth Act talks about centralized coordinated intake. And how many of you are involved in the centralized coordinated assessment, is what they call it? Because we just actually started our centralized coordinated assessment this last year. And we've been actually operating for really 2.5 months with that. And we probably have the best data that we've ever had in our history as an agency, as far as what interventions are going to end what type of homelessness, and what intervention will end homelessness. So I know when a family comes into our intake center, of the 4 interventions that we assess families for, I know which intervention is going to end their homelessness, and which to me, for a provider for all my life, to be able to have that information, to me is golden. Because you know that a lot of your funders, whether it's the federal government, the state, United Way, private foundations, they want data, and they want good data, and when they want to know if your outcomes are working. And I really believe in some of the changes that are coming down through the Hearth Act, and one of the best ones, I think, is centralized coordinated assessment, to be able to gather that information. Now, our local HMIS right now is working on folding our system into the HMI data system, which will be great. Right now, we're just collecting that data on our own, but they're working on being able to collapse that system so we can really have better data a lot quicker. So I think the coordination, the data collection are just really key. Let me look here. Now, the tool that we're using, how many of you are familiar with the SPDAT tool? And the FSPDAT is what we're using in our agency for families, but I believe for youth, the SPDAT tool is the tool that's probably most of us will be using as we move forward. And I know, I just wanted to share a little bit of that data that we've collected just in a week at our family housing hub. We had a total of 639 calls. We know that 564 of those were from Phoenix, 25 were from the East Valley, and 50 were from the West Valley. 33 of those calls were only seeking information and referral, and 606 were seeking homeless services. We saw a total of 46 families in person that week, 34 from Phoenix, 5 from East Valley, 7 from West Valley. But 11 of those needed just information and referrals, and 35 of those needed to be were placed on our service priority list, which includes shelter, transitional, rapid rehousing, and permanent supportive housing. Right now, we have a waiting list for all 4 of those interventions. And what we've done with our service priority list for our emergency shelters, we prioritize by those who are living on the streets and those who are staying with another person or family or in a situation where they have at least 30 days. But overall, in the 8 weeks that we've been using this coordinated intake system, we've been able to divert 31% from even entering into the shelter world. And that's because all they really needed was a list of affordable housing places, a list of services. So not everybody that calls, you can assume that is going to need that emergency shelter. Now, that's information that we never really had before. So, you know, my final note, I'm probably running out of time here, but is just to keep your eyes wide open, because this is all going to be good at the end. And I really do see some good things happening at the end of the tunnel, because all of you in the room need to become very active, again, because we can't wait till 2020. And the only way for us to push the envelope on that is to become involved. Thank you.
So Darlene asked me if she was in trouble. She's not in trouble. Maybe she opened a few wounds but that's okay, because it's stuff we need to talk about. So the 3 that I noted, right, are the pit, because we'll get to this in a little bit, but I'm just going to say up front, right? We know that the pit, the way it's currently done with adults, isn't the way it should be done for youth. We're not there yet. HUD's there in knowing that. Getting us all to the place where we figure out how to actually get an accurate count is another thing, and we're working on it. So I'll get to that in a bit too. COC rankings and youth providers being at the bottom of the list. We also know that that is a challenge, and we are trying desperately to work with COCs to help them understand that that's not the way it should be. And then the third thing is coordinated assessment. And I know that when folks talk about coordinated assessment, there's a little bit of fear in the room, because what they think we're saying is that we want to put youth in a coordinated assessment system that works for adults. And that's not what we're saying. Do we have a coordinated assessment instrument right now that we can stand behind and say works for youth? I don't know that that's the case. There are ones working with families, the Family SPDAT. There's, I think, actually in Minnesota, folks are testing out the youth SPDAT, a youth-specific SPDAT. Is there anybody in Minnesota who knows about that here? Anyway, oh, someone back there actually does exist. All right. I did get my place right. So those are, I mean, thanks, Darlene, for opening those, and thanks for actually, pointing out some of the places where we do see a light at the end of the tunnel here, too, and we think we're moving in the right direction. So transition to the next slide. So this is, again, stuff that Brett has talked about. Multiple federal agencies with our own data needs and priorities are all working together with HMIS. And this is honestly one of the most impressive partnerships I've seen during my time as a Fed. We've learned so much from one another in this process. We're in the final stages of an MOU. I can't remember if it was Mark or Bill who talked about this earlier, but we're so close to having that executed. And I think Debbie said earlier that the great thing about Bill is that he holds folks accountable, and he's holding me accountable on this, and that's good. I'm the one that's got to get it done. And then we've been meeting at least quarterly to talk through these issues, make recommendations to one another, and most importantly, learn together, and to get better at communicating with and to you and with you and together and communicating better. And we're all bad at it, and we're trying to do better, and here we go, right? So here's the contentious slide, right? So we've seen how collaboration accounting has helped our count on homeless veterans. We've been doing it for several years, and we're hoping that the same level of coordination will help us benefit how we count youth as well, particularly in the HMIS system is what I'm talking about. So I'm just going to take a step back a little bit, and you heard some of this from Risa earlier, a little bit of my background, but I'm going to say it again. So before I came to the federal government, we lost Karen. Wah, wah. All right, so before I came to the federal government, I was working with youth experiencing homelessness in St. Louis. Where are the St. Louis folks at? Woo! Excuse me, I got my master's in social work with a focus on youth empowerment and youth organizing. And before I joined the administration, I would have called myself an advocate. I actually came over to HUD a year ago from ACYF, but I know you don't really care about my professional story, but I tell you this because I'm at HUD now, in part because HUD really is trying to figure out how to prioritize youth. Have we run the whole marathon yet? No, but we've started. We still have a ways to go, and we don't think we need to start in 2020. We think we need to start sooner. And we are not complacent, and we're listening to you, and we're working to be aligned with the USICH Youth Framework. So I'm just going to touch on a couple of things that we have put out within the last year. So this first one, hopefully these slides will be available later so you can see them. So this one is actually just a cutout of the point-in-time guidance that we put out for communities earlier this year. We have a whole section specifically dedicated to how you count homeless youth, saying that it's not the same as it is for counting adults, and that there need to be RHY folks at the table in your community helping you get to where these young people are. That's exactly what that document says. We know that not all communities are currently counting youth well, and we know that you don't go looking in the same places for young people that you go looking for older adults. And like Mark said earlier, we know our top line youth PIT number is likely an undercount and likely to keep ticking up until we get better at counting youth. Again, are we perfect now? No. Improving? Yes. And our hope is that getting to a better count will help us justify a bigger pie to Congress, not just a reslicing of the current pie. And just a few months ago, we published a document that clarifies how the definition of homelessness applies to youth. I know that there's lots of folks who want to talk about that. And delivered it to COCs with a note that clearly explains that HUD expects COCs to be paying attention to what it needs to have in place to end homelessness among youth by 2020. Not to start then, to end it then. As a part of that, we described the recently published System Performance Measures Introductory Guide, a guide that describes our new system performance measures. The key difference between these system performance measures and the traditional performance measures is that the system performance measures capture outcomes for all homeless people in the COC's geographic area, regardless of whether they're served by COC-funded programs. This is crucial because it means that COCs cannot improve their performance. They can't get a better COC score by simply failing to serve people for whom it's harder to achieve positive outcomes. We've heard that happens time and time again with youth programs. For example, and this is key, if a COC chooses not to fund a youth program, the youth that would have been served by that program will still be included in the COC's system performance measures. If the outcomes for those youth decline because there are fewer programs to serve them, the COC's overall performance will decline. As we develop our measures and the incentives that will accompany them, we are taking great care to ensure that, if anything, we create incentives to provide more assistance to people like unaccompanied youth who have greater challenges to exiting homelessness and maintaining safe and stable housing. Oh, I didn't click on that one. So that was the in focus that actually talked about that, a message directly to COCs. And then finally, of course, the reason I was invited here today, we've published data standards for HMIS that reflect the measures required to be collected by RHY programs. So, and I have one more thought that I want to close with today before I pass it to Lisa to tell you what happens next for you in your data collection and reporting adventures. You consider them adventures, right? All right, I want to leave you with this, and this is going to blow your mind. It blew my mind when I first absorbed it. There are actually people in this country that actually believe that we can end homelessness in this country. There are. There are people in the federal government who are working to end homelessness. Yes, they process your grants and they run your grant competitions, but they also believe that what they are doing and what you are doing is going to end homelessness. For veterans in their community, we have multiple communities on the verge of claiming an end to homelessness for veterans in their community by the end of this year. Where are my New Orleans folks at? Is there anybody from New Orleans in the room? Over here? Right. So your mayor has said in your community, by all indications, will have provided a house and a future for every single veteran who didn't have one in the next 52 days. They will accomplish that in the next 52 days. And their HMIS data and their PIT data have proven that they actually have the capacity to do that. And ending homelessness for those older men and women who have been living on the street for a very long time, with Congress funding us at the administration's ask, we will get nearly every one of those people into permanent housing by the end of 2016. So why do I share this with you, right? Because I've been in your chair. I thought, yeah, well, what about youth, right? Where are youth in chronic and veteran homelessness? Where's that belief for youth? Does HUD really believe that for youth? Well, I'm admitting to you that I didn't believe it before. I didn't believe that we would end veteran homelessness by the end of 2015, and I didn't believe that we would end chronic homelessness by the end of 2016. And I also thought that HUD was never going to believe that we'd end youth homelessness. They just weren't going to chalk it up, and they weren't going to do it. Because they don't understand youth, and they only care about adults, and they don't understand that youth are different. So, but now I'm them, right? And I know they get it, but I also am realizing that this process takes time. And I've also sat in the chair at HUD for a year now, and I've seen this method work for these other populations, driving with the data, having the array of tools necessary to solve the problem. And I've seen how cities unite behind a social issue that, despite what folks want to tell you, a social issue that is not intractable. And I believe we will get there for youth. I believe we will end youth homelessness in this country. I'm not naive. I don't think we can prevent every single future episode of homelessness. And I know we won't prevent every single family breakdown. And I know we won't solve poverty in the next 6 years. But I believe we have the ability to get a system in place that provides the full array of housing, education, employment, relational and social emotional needs for youth that are appropriate for young people in that period of life. And I believe we will make the commitment to ensure that no more young people have to sleep on our streets because there isn't a place that's for them. So I drank the Kool-Aid. I believe we will do it. And there's many other federal partners who will stand with us and claim their belief in our ability to end youth homelessness. This data alignment and integration is an important step. So I believe, I hope you will too, and there's some Kool-Aid outside.
Wow, isn't that a wonderful person to have on our team? Yeah. One more time for Sarah. Okay, so reporting RHYMIS data. This is the interesting part. This is where the fun actually begins, right? This marks the culmination of all the work that we've put into this effort over the last 5 years. It's actually been longer, but we've just began to pick up steam once we brought some of the key players of all of our organizations together, and they agreed that this was something that could benefit our programs, and more importantly, it could benefit the young people who we're here tasked to serve. So you'll hear words like RHYMIS integration, and actually that's deliberate language, because what we want to do is to illustrate the joining of RHYMIS youth data into an HMIS interface. And the reassurance for you is that we will still maintain control of our RHYMIS data, and we will still capture the data that is youth level. It's just going to be through a different system. So hopefully you understand that when we use that term integration, it's really, or even migration. Sometimes you've heard that word, that term as well. But it's really just about us joining a new data collection system. And that means that RHYMIS, the desktop system that you've grown accustomed to over the years, will no longer be used in our data collection efforts. Now I have to tell you, I had to fight the desire to put together a video montage of people entering data in slow-mo into RHYMIS with like Arms of the Angel, playing in the background. So I didn't do that because really, this is a celebration for us. It marks a transition for us to grow into using data in more effective ways. And so we won't have any sad songs here today. But one of the things that I have to tell you is that some of you may continue to use RHYMIS as your case management system. And we understand that some of the smaller agencies are using it because they don't have other resources. But as of October 31st, there won't be any more technical assistance for that particular data system. And that means that some of you, I know, are experiencing some issues with accessing the system again. And we're working on getting you guidance on how to resolve those problems. And I will leave my email address, RHYMIS email address, for you to contact me directly if you are one of those agencies experiencing certain technical difficulties with the system, and we'll try to help resolve them. But the days of calling the help desk for that system are over. Grantees are expected to use the HMIS data system that's been adopted by their COC. We will need you to continue to collect individual youth level records, but we're looking for you to do what you've done. So collect the data for RHYMIS that has already been approved. By January 2015, we're hoping that we get our final approval from OMB regarding the new and improved data that you'll see in the HMIS system. And at that point, we do expect you to start to capture the full, more robust data sets that you'll see there. The positive, again, is that you'll continue to capture youth level data, individual youth records in HMIS, and it will be an open profile format. So even though you'll see certain workflows that say these questions should be asked upon entry, these questions should be asked at exit, It's actually an opportunity for you to fill in the services that you are rendering to young people as they are delivered. And so you don't have a set and rigid entry questionnaire and exit questionnaire. And again, the benefit is that it helps us as we do our data analysis. And anytime that we may need to report, do some immediate analysis, we'll be able to see exactly where our grantees are at that moment in time. And so that's going to be a benefit. Now, we know that there are fees associated with joining or getting involved in your COCs and using specific HMIS systems, but those licensing fees can be supported through your RHY grant. So, okay. So hopefully you find that to be at least a benefit to you as you move forward. Okay, so data will be captured in 3 ways. So one way is site information. So we'll start to be able to see the structure of the grantees. We'll be able to see if there is a primary grantee that has sub-grantees, and that data will all be connected to that primary grantee, or we can look at it based on individual sites as well. And it will also help us capture bed counts. And that's something that we've had to embark upon a very tedious effort to capture how many beds you all are saying are available at your organizations. And this will help us develop a site profile, and then we'll actually start to capture those universal data elements. And those are typically about the characteristics of youth demographics. Those will be the data that all federal partners will be capturing. And then from there, the third is that we will start to capture our specific program data. So every program that's involved in this federal effort will have their own space to ask questions that are relevant to their own programs. And that's going to be a benefit to us as well, because again, we can maintain control over our own data. And so what you'll see are improved data measures. So we've added a few things, we've refined a few questions, and we've eliminated a couple here and there as well, but all in the name of trying to get the best data that we can get from you. And so you'll see that we ask about veteran status, we ask about income, non-cash benefits, we ask about health insurance coverage to see if our young people are carrying any coverage at all. And that's along the lines of the HIPAA laws. And so we said, let's try to see if we can gather some information to support that. And you'll also see the commercial sexual exploitation and labor trafficking. And that's a new question that we were able to add in and actually expand so that we can get a more clear understanding, and we can capture it in the data that we collect from you all about what is happening to young people. We know that as you do your case management, you're getting the narrative. They're telling you what's going on. Sometimes some people are a little more open than others. But again, this will allow us to be able to look at our youth profiles and the characteristics of the young people that we serve and say, this is a real problem, and here's how we can quantify that. And so that's something behind support for that measure. And you'll also see the expanded street outreach. Now, about 5 years ago, we convened street outreach providers, and you came to the table. We said, hey, what kind of data can you capture? Because we understand that usually when you're on the street with a young person, it's very difficult to capture really detailed levels of information. But what we heard from you is that, A, many of you already capture certain detailed pieces of information from the young people that you are encountering on the street. And those of you who weren't said, guess what? We can capture a little more than the aggregate data that we've already been capturing. So by us expanding the street outreach data elements, we're not expecting that you'll be able to develop a full profile for a young person that you encounter in the street, the same way as you might with a young person who's sitting next to you answering questions. But we're trying to give you an opportunity to develop a profile for the young person, which means we can find out how many contacts that it takes for you to develop a full profile, to get all of the information about a young person, and then how many contacts it takes to get a young person actually into a shelter. And that's very valuable information. And again, it's helping to improve the quality of data that we have. Confidentiality of data has probably been an issue for some of you, but we will identifiable records will not be shared. That's something that regulations speak to, and so we will maintain that. There are certain exceptions where records might be shared between agencies, and that's really in the event that it is a primary funded agency that has multiple sites. And so sometimes the structure of those types of organizations require that the primary grantee have access to data, especially in instances where they are the reporting, they are the ones who report the data. So we're going to try to work with you to maintain certain structures around that. But the leads for HMIS, the COC leads, they may access information, but again, it won't be shared identifiable information for our young people. Now, young people who are over the age of 18 or who are emancipated, they may have the right to consent to share their data. But those are really the only three exceptions that information might be shared at that level. So again, grantees should plan to migrate, which doesn't mean that it will be automatic, unfortunately. You will be charged with taking your data and entering it into the HMIS system. So all records as of October 1st, 2014 should eventually be moved into the HMIS system. And we expect that everybody will begin using the system by April 2015. And so that gives you some time to start to get those records that you have that haven't closed, get those into the system, and then you can serve young people from the new system once you get completely integrated into HMIS. So we'll run our official report for the year, October 2015. So that'll be the first report that we will actually run that will capture all of our 2014 data, but we will start to do some system testing sometime in that summer and spring so that we can make sure that by the time we get to October that all systems are working. Now what you'll see is RHYMIS is still going to be our data. And you'll see that RHYMIS will continue to come to us. It will be individual level. But then we will also send RHYMIS data in aggregate to HUD. And that's primarily how it will work. So our data won't be filtered through HMIS. It'll just be a way of you all entering youth data, us taking our individual level records and validating them and reporting on them, and HUD taking the aggregate data that they typically use to inform their reports and moving forward. So again, we still maintain control of our data. So what are some of the next steps? We talked about October 24th, the letter went out to you all, and we made it a point to have your assigned COC included in that letter because we didn't want to add the extra burden of you having to try to search out and find out who you needed to contact. So what we did was make sure that we got you your assigned COC and the contact person that you can contact. Now may I ask, for those of you who have not already been a part of a HUD COC and you've received that letter, how many of you have been able to reach out to your COCs? Okay, so we have work to do. That's absolutely correct. Okay. Okay, so it's going to be important that you do that. Okay, so when you go back, that's the easiest way for you to get involved, is to contact that person and say, hey, we're new. But some of you have an invaluable resource already within your organization. Because some of the ways that organizations are structured, you may not know exactly what funding mechanisms are going to support your various programs. So one of the things that I would do is I would definitely go back and make sure that I know whether or not we are actually HUD funded. Because what that will do for you is cut down the period of transition. Because even if that program is not a youth-focused program or not a shelter program per se, the chances are that person is already a part of the COC for your organization, and they already have contacts and understand what the training, when training is available and such. And so that will be an easy way for you to be able to have someone to facilitate facilitate your integration into HMIS. And so I encourage you to not only make contact with your COC lead, but to also find out if you are currently receiving HUD funding. The frequency of training opportunities will vary, and so again, once you get into that, they will give you schedules and timelines. And we also ask that you'll participate in the training opportunities that FISB offers, because we want to make sure that you are trained in HMIS on the technical system side, but then we also want to make sure that you receive crosswalks and other training on the interpretations of the data elements. So again, this just summarizes some of the things that I said. We want you to continue to capture RHYMIS data. We want you to be prepared to have all of your data into the HMIS system no later than April 15, 2015. We'll start to do some practice runs in the summer of 2015, and an official report will be conducted in October. And as it was already explained by our representative of the COC here, is that it's going to be really important that you not only use this as an opportunity to enter data into HMIS, but to become an active part of your COC community, because that's really the only way that our voices will be heard and that you can make sure that our young people have a seat at the table. So here are some resources for you. The email that I spoke about earlier, RHYMIS@acf.hhs.gov. We also have the National RHYMIS database in the event that you want to look at national RHYMIS data, or you can also filter by region, state, and down to individual organizations as well. And the HUD Exchange, that's really going to be valuable for you if you want to get a jump start on some of the training and some of the tools that are available. You'll be able to look at our actual data guide, so you'll see what all of the federal partners are capturing, and then you'll also be able to see what data elements that we'll be capturing for the RHY program. So I know that we're short on time, so we'll open it up to questions.
All right, thank you, everyone. Can we just give them another round of applause for all of the information? So thank you, Brett, Talisa, Sarah, Darlene, and I know we lost Karen de Blasio, who's on the phone. Were we able to get her back? Okay, so I think that this has been a very informative session for everyone, and I know that as I was listening, I was taking notes in terms of all of the benefits that this RHYMIS HMS integration will provide. And so we know that it's an opportunity to get our RHY youth data into the HUD's report to Congress, so that's a huge benefit. It's definitely reduced data reporting burden for you. You have the opportunity to have new questions on human trafficking as part of your RHYMIS data set. There's fluid data entry, as Talisa mentioned. And then, as Darlene mentioned, to really get involved in your local COC and get involved in your COC board and point in time count. And then I know a lot of you struggle with the current system for RHYMIS in terms of it's definitely just on your desktop. So you'll actually be able to have access from any computer in terms of your new RHYMIS data. And just to reiterate, I think Brett mentioned it earlier, but I also wanted to let everyone know that we're going to take some time for questions. And if we don't get your questions answered today, there is a breakout session tomorrow morning from 9 to 10:30 in the Navajo room on the on the first floor, and Brett, Talisa, and Sarah will be there. We'll actually have a couple of our runaway and homeless youth grantees there as well to talk about their experience in terms of working with the HMIS system. So without further ado, I'm going to open it up to questions.
Aloha. I have been informed that the HMIS system in my area is not compliant with HUD's requirements. How does this affect my compliance with FISB requirements if the system itself is defective?
That's not working. So I think we're going to let the HUD representative answer that one.
Can we get another mic up here? This one doesn't seem to be working.
Just come on up. We'll just use this.
I'm just going to pretend like the mic doesn't work and talk into a blank mic. And no, so I mean that's a great conundrum to find yourself in. If you have that problem, come talk to me afterward. I don't think that's a widespread problem, but if it is, I want to know about it. And I wish that I could transition to Karen, but she's not here. she left me all alone. But obviously, if that's an issue in your community, we're going to have to work that out before you can report to the FISB folks, and we will help you work that out.
Yeah. So, because basically that's just not supposed to happen. So if it is, let us know right away. We'll make sure it does.
Hi. I have a quick question, but first I just need to acknowledge that for some of us who aren't entering HMIS currently, the contention that it reduces our data entry load is I respectfully disagree. But I have a question about, we have multiple geographic sites for our programs, and some of those sites exist in different continuums. Will we need to enter data in separate continuum systems for each site?
Yes, you will. But I think that one of the things that, as I spoke about earlier, is that the primary organization will have access to that data as well. So there may be an opportunity for them to submit, but we're working through that right now.
Just come and talk to me about that afterwards, okay? Because that's something we clearly need to. Okay.
And I just asked Sarah the question that even though you have different local COCs, some of them are using the same vendor, so it may be a moot point in terms of looking at, some of it may not be, but looking at the fact that it's the same vendor, you'll be using the same system. Other questions?
Lisa, I don't have a question, just have a comment. You know, as we've heard from the speakers, that we worked really hard over the last 5-6 years to integrate this RHYMIS HMIS system, and I just don't want to give the impression that RHYMIS goes away, okay? And all I've heard referred to this integration as HMIS, and it's we fought very hard for this integration to be labeled HMIS RHYMIS because it still gives our grantees the understanding that we are not being taken over by HMIS. We are integrating to make sure the dynamics of the data is richer. We can do better with knowing how many youth we're serving. So I really, really ask HUD as well as FISB as well as any other persons referring to this integration that we call it the HMIS RHYMIS integration, and that will also help the COCs understand that we are equal. And so it's not HMIS, it's our data as well. And so I really ask everybody in this room, when you talk about it, it's the HMIS RHYMIS integration.
Hi, I think I have more of a comment than a question, because I remember, I think one of my first conferences I came to, and we were talking about the integration from RHYMIS to HMIS, and I've actually seen that happen. So I got to kind of commend FISB for doing that, because that was some of the requests that we already said. We're already entering a lot of data into different systems, and that was one of the things that we wanted to see happen, and it is actually happening. So, I mean, you guys are like movers and shakers. I know sometimes people can be a little apprehensive about the new changes, but you know, putting the data into the HMIS system as it is into RHYMIS, it's going to be is a perfect marriage. You know I'm a part of a COC, and we put data into HMIS, and then if we have other information, it's actually exported into other systems. So I mean, it's a really good system. So, but I'd just like to thank FISB for actually doing that, because that was one of the things we said. You know, we're entering data into all different type of systems, and actually I've seen it happen. So, thank you.
Hi, you guys. Okay, so I'm just speaking as like someone who's received the services and now someone who's also providing the services. One of you mentioned how the belief in the youth that HUD wants to help in homelessness. Well, one of the concerns I was having, because we're working on like the point in time count and we're like interacting with youth so they can also help us so that, you know, we can get accurate numbers. How are you guys wanting to end youth homelessness, but the definition of HUD's homeless is so strict? Because from my understanding, this is just my understanding, like, if you have like a homeless youth who's like a senior in high school and like the parents are incarcerated, they have nowhere to go, and they're staying at their friend's house for the next 2 days, then that kid is not considered homeless because their friend is letting them stay there for 2 days. So then that's just like, and then that's one more youth that we're not counting as homeless.
So I know that the definition is a big point of contention. So I would actually point folks in the room to the document that I mentioned in the In Focus on youth homelessness that we put out in October. So one of the examples in that, so this isn't a perfect example to align with what you're talking about. Well, one of the examples in that, it says, a 15-year-old has been staying with her best friend, but the friend's father tells her she can't stay any longer, must leave tomorrow. An acquaintance has offered her to let them stay there, but she doesn't feel safe there. She can't go home, she has nowhere else to go. The 15-year-old meets the criteria for Category 2. Now I'm going to admit, right, so I don't have a complex understanding of HUD's definition. It's not where I sit in HUD, and so you can come beat me up for that after this. I totally will take it. But I also want to say that the categories of homelessness that we have, they're categories that are given to us statutorily, and we're trying to figure out how youth fit in them. And we've put out a little bit of work on trying to help us understand how they actually do fit into those categories. And I know there's some work out there to change the definition. And to be frank, we're going to disagree with you on that point, right? To change the definition, we have limited resources. Congress has given us limited resources, and I know that that's not a popular position for me to sit here and say today, and I know that a lot of you are going to want to talk to me about it afterwards. But I encourage you first to go read the document if you haven't read it, and then when you have questions after that document, to come talk to me. Wait, sorry, one more thing. And I also want to make sure that what we're talking about today is I want us to figure out how to do this together. I want us to be able to figure out how we have a common goal, and how we actually work on the places where the definition doesn't meet up with who you're seeing on the street or who you're seeing that actually needs services. And then how we figure out what the array of services and what the array of housing is to meet that set of folks. And if they're a set of housing or a set of services that actually aren't provided in the homelessness programs, but are provided somewhere else, either in HUD or through some other funding stream, that we figure out what that actual array looks like.
And I'll just add that it's not perfect, but we're working through some of the challenges that we're experiencing. And I have to say that as partners with HUD, they've been very committed to this. And I know that, and Sarah didn't mention this, but I know about a month ago, I got an email from her. She wanted to meet, and she's like, we need to talk more about how to serve homeless youth. You know, what can we learn from FISB in terms of the work we're doing, and how we can learn from HUD in terms of some of the services that they provide. So I know we're starting those discussions in terms of the next step as we move from the RHYMIS HMIS integration to looking at how do we better serve youth, and how do we do that collaboratively with HUD. Other questions?
I just have a quick question. I almost forgot what it was, but we've been a part of our COC for many, many years, and we've been inputting our HMIS information, our homeless youth programs into HMIS who are funded through RHYMIS. And so I'm just wondering, do we have to, since they're already in there in HMIS, because we do it anyway, so the transition, does that mean we just continue doing what we're doing and don't input into NeoRHYMIS anymore? Because you said it was an October cutoff date?
If you're already using HMIS software to enter your data, then I think you would be good to go. I didn't realize there were that many people that were already using it for runaway homeless youth data.
So just to clarify that you're entering your RHYMIS data into the HMIS system, correct?
We're entering into RHYMIS and we're entering into HMIS. We're continuing on there. That's what we're supposed to be doing. But what I'm saying is, we now no longer have to do RHYMIS, we just continue inputting into HMIS.
Whatever the kids were that you were putting into RHYMIS, you now need to put into HMIS. You should not be putting the same kids into, right?
Two systems.
All right, well then, but you should, yes, you'll have to, I think you'll have, the answer is you'll have to put them in separately, because you still have to report to us separately, right? No?
So just to make sure that we understand and respond to your question accurately, it's once, and Talisa mentioned this, we're working to get OMB clearance for our RHYMIS data. And then once we get clearance to do that, yes, you will have to enter your RHYMIS data into the new system.
So as of October 1st, right, your COC would have been implementing the new COC, the new data standards that HUD sent out. And so those new data standards have RHY specific elements in it, and you are currently entering your RHY funded youth with those RHY specific elements because your COC has programmed to that. So whenever they give you the green light, you can stop inputting into both systems. So and you won't have to do the back logging because you will already have been putting them in since October 1st.
Sorry.
All right, we'll take one last question or comment. I think we've run over time, but I just want to remind everyone that there is another session tomorrow morning from 9 to 10:30 in the Navajo room. So if you didn't get your questions answered today, please make sure you attend that session.
And you can also please approach us in between sessions at the meet and greet this evening. I'm totally open to talking one-on-one and try to answer your questions.
Hi.
Yes.
Okay. Thanks. Jim Bolas, Coalition for Homeless Youth. In New York, you had mentioned about the point in time, and I just want to draw some attention to that, and you said, it had its problems, and we were one of the 9 sites to integrate youth gathering youth information in that. And it, it wasn't perfect. In other sites it was. And you had suggested about that runaway homeless youth programs can gather their own data. My concern, however, is that HUD would not necessarily acknowledge that data in their report. And the people that read the data reports, they read the HUD reports as far as when it comes to attributing dollars to numbers and that sort of thing. Right. So my concern is there, or maybe you could explain this, or if there's any plan to integrate the any RHY study data counts aside from the point-in-time counts into your point-in-time data reporting.
I think that's a question for me. So I think we'd be open to it. Like, let's talk about what that would look like and what that data so without a concrete kind of set of things, I'm not sure exactly what we're talking about. But I can say that working with the VA over the past several years, we've been able to make some shifts of some measures that go into the AHAR that are based on the PIT count in the collaboration that we've had with the VA. And so those things have changed a little bit over time based on that collaboration. So I think that there's an opportunity to do that. And let's have a conversation about what those specific things are, and let's bring it to the table for the folks at HUD who are working on that.
Just want to say thank you all. I know that we were supposed to break at 3:15 and come back at 3:30 for the next phase of our session. So if you guys want to take a stretch, use the restroom, and then we'll try to start back at about 3:35. So thank you again for your time. gentleman there was saying that, like he was saying that it seems as though they're entering it into multiple systems. Like sometimes the vendors will have the similar systems within the different local COCs. He was shaking his head that that may not be the case.
Well, I'm wondering whether we can, and this would, we have to ask HUD if they would be comfortable with choosing one COC entering all the data to the COC, but then the COC would have to separate out the non-COC from the COC when they're doing their aggregating those data.
Yeah. So this is where I think we need to start developing some they can be asked questions. Because if it comes up now, it's going to come up again.
I'm going to go talk to that guy right now just to make sure that he's not taking it.
No. Someone's back. Totally understand that. We get that.
Okay. Tonight.
Someone's bag. Is this your bag? Or?
Yes, sir. She wasn't back
I'm trying to think.
on the right.
There's 3 places for you, Gordon and Tammy, if you guys want to sit up here, and then the 3 of us on this side. So that'll work. I don't see Gordon though. I don't. I have not. So we're going to have our networks of support on this side, or however.
You're on this side.
Okay, everyone, let's go ahead and get started. I know we still have a lot to accomplish in less than an hour, but we want to go ahead and make sure we have enough time to give you all the information we want to share with you. Okay, so for this part of the federal session, we wanted to give you some of, as I mentioned earlier, we wanted to give you some of the updates in terms of some of the FISB initiatives that we're working on. And so this gives us an opportunity to share a little bit more detail. I know Mark Greenberg mentioned some of the information we're going to share with you at the higher level, but we're going to dive a little bit deeper into some of that information. And so here, you have Chris Holloway, who is one of our Runaway and Homeless Youth Program Managers in Central Office. We have Bill Clare, who is our Program Manager out in the region. But we also wanted to take the opportunity to have our networks of support, NICFI and RHYTAC and our Safe Line, also provide some of the updates that they're doing in terms of the work that they're doing with us. So without further ado, we'll go ahead and get started. I know after this session, you have the opportunity to meet with your project officers. So I think does anyone need to know who their project officer is in terms of meeting with them? Because if that's the case, I can go over them really quickly in terms of the regions. Can I see a show of hands in terms of people who do not know what their project officer looks like so I can have them stand? Okay, I see a couple of hands. Okay, so from Region 1, Mary Ellen Connors. So this is who you'll be meeting with for Region 1. For Region 2, we have Asita McGee, who's over here. Region 3, stand up again, Asita, so they can see you. Region 3, we have Habiba Suleiman. Habiba. So hopefully I'll announce her name again. From Region 4, we have Pam Marr and Carolyn Bates. I see Carolyn here. Pam? Okay, she went to get a cookie. From Region 5, we have Jenny. And from Region 6, we have Rebecca Eichelberger, who's back there, and Paul Bowser. Okay, so Paul will be back shortly. And from Region 7, we have Linda Cloud. I just saw her walk in. And we have Raymond Hicks. Can you stand up, Raymond, so they can see you? Region 8, we have Deb Yatsko. Region 9, we have Deborah Oppenheim. Oh, Pam, there's Pam Marr from Region 4. In Region 10, we have Steve Ice, we have Janice Holt, and they're back there. So without further ado, so everyone knows what their project officer looks like. And I'll again, I forget, remind me to announce Habiba so she can stand up and you can see who she is. So today we're just going to go over some of the data collection efforts we have within FISB, our capacity building efforts, and I won't read all of them because I think you can see them here, but you will hear about them. So I think in terms, we heard Mark mention it, and I think we've heard a couple of the other presenters mention the fact that FISB has been working really closely with the U.S. Interagency Council on Homelessness to end the goal, with the goal of ending youth homelessness by 2020. And so the Opening Doors plan is something that we've been very proud of, and one of the two of the goals is to getting to better data and then also working to build capacity for impact. And so what I'm going to share with you is some of our data collection efforts as well as some of our capacity building efforts that we've engaged in over the last couple of years, but also give some updates in terms of what sort of accomplishments we've made to date. So in terms of our data collection efforts, I know many of you heard that we had a media event on October 22nd where we launched or we released our street outreach data collection executive summary, and we had Cindy Lauper as well as 3 youth, I see someone smiling here, 3 youth to tell their stories. And so I'm going to go a little bit more, take a deeper dive into the street data collection efforts and present some of the findings. And I know the reason we're so proud of it is it's a first of a kind data collection effort for FISB, and we actually anticipate that the report will be out in January. It's got to go through the approval process throughout ACF, and so we anticipate that we'll have the full report available to everyone in January. So just to talk about the purpose of it was to better understand the service needs of our street youth. And we had 11 of our street outreach grantees collected the data from youth. It's about 656 youth that participated in the interviews between the ages of 14 and 21. And so they conducted computer-assisted interviews with the youth, and then with a smaller set of youth, they conducted focus groups. And just to talk quickly about some of the recruitment methods, they used respondent-driven sampling, where they used one youth who will then go back to their neighborhoods or where they hang out and try to recruit other youth to come in. And so they were given incentives. I think they were given gift cards to participate in the study. And then because we did not get the sample size or the number of youth that we anticipated with respondent-driven sampling, we then focused on doing convenience sampling to get the sample size or the number of youth that we wanted to participate in the study. So just to go over quickly some of the demographics, we see that 70% of the youth were between the ages of 19 and 21. We had 54% female, 30% LGB, and 7%, or it's actually 6.8% transgendered youth that participated in the study. So in terms of homeless experience that youth reported, 74% reported they had been kicked out or left home due to family conflict. And we see that the average length of time homeless was about 23 months on and off for youth. And looking at youth reports in terms of their sexual health, we see that 24% reported they had sex in exchange for money, 28% had sex in exchange for a place to spend a night, and 20% reported having a sexually transmitted infection at some point in their lives. As we look at youth victimization once they're on the street, 41% had been robbed, 41% had been threatened with a weapon, and 15% reported being sexually assaulted or raped. Looking at some of the behavioral health for our street youth, 62% struggled with depression, and I think they used a CSD, and I think about the same amount of youth actually were at a level of being clinically depressed. 73% reported alcohol use, and I think this goes back to the question this morning during one of the sessions in terms of looking at youth substance abuse and mental health. And then 30% reported other drug use to include cocaine, methamphetamines, and so forth. In terms of the basic needs, we had 55% of the youth said that they needed shelter, 71% employment, 55% education, 67% transportation, and 60% clothing. And I think this is a really critical piece in terms of the basic needs for youth. There's such a huge gap in terms of them not being able to get them, especially shelter. And I think that's an important piece that we actually highlighted at the media event as well. So in terms of some of the implications for this study, and I know we'll definitely be presenting more information in terms of the final report, but we know that youth require tailored, this is nothing new to you in terms of the work you do, but they do require tailored services and supports, and I think that's where the youth intervention model, I think, really fits in nicely with the work that you're doing, because once you're able to do the screening and assessments, that will help you then get a better picture of the youth and tailor services to meet their needs. Better coordination is needed among service providers. I know you are all working to do that, but I think there's always room for improvement to do that. And then especially looking at linkages among community and local government that serve the same youth. And I think we've worked to do some of that in terms of the information memorandum that we've provided, working with youth who have run away from the foster care system. So we definitely need to do a better coordination and linkage with our local governments as well. And then in terms of enhanced screening and assessment, we looked at 30% reported that they were LGBT. And so to that end, I think the better screening and assessment we have, I think we can better tailor the needs to the various subpopulations that we serve, whether it's LGBTQ youth, whether it's trafficked youth, whether it's pregnant and parenting youth. And I think that one of the things that we're talking about at ACF as a whole, and we have an interagency work group on it, is looking at youth homelessness. And I don't think it was mentioned, but I know the HHS secretary is going to sit on the council. And so we're looking at what are some of the opportunities that we can bring to her attention. Prevention, I think, is one of them. We're looking at ways how we can develop better screening and assessments. I know we're working on that in terms of looking at trafficked youth, but we want to do that for youth in general. And how do we triage, how do we screen youth and triage them in terms of providing them with the services and supports they need, and looking at typology of youth, whether it's whether they've been chronically homeless or they've just recently run away. And then I provided the link for the executive summary, which can be found on our ACF website. And I think that, I'm not sure if Nick Fee is going to provide the link as well, or.
We have some sitting at our table.
So they do have some copies of the executive summary at the Nick Fee table out front. So if you haven't seen it, please feel free to stop by and get a copy. So the other data collection effort that we've engaged in, I think we mentioned it last year, but just wanted to give you some updates in terms of some of the progress we've made, is our transitional living program evaluation. Last year we mentioned that we were going to have 15 transitional living programs participate. It's actually going to be 14. But really we wanted to learn about the effects of the transitional living program services on youth. And so it's going to be a randomized control trial that will explore both the processes of the transitional living programs as well as the impact the programs have on youth. And so data collection, we've also worked to revise it. It's going to be at baseline 3 months, 9 months, and 12 months. We actually had a 6-month data collection point in there as well as an 18-month data collection point, but unfortunately we're unable to do that. As part of collecting process information,